Hello, and thank you for joining us today for the Nova Healthcare Administrators webinar on telehealth solutions. This is part of our Spectrum series. We're going to dive into what that means a little bit more in just a minute, but first we wanted to welcome you. Thank you for joining us for our program today. And I'm happy to introduce today's speakers. You have myself, I'm your host, I'm the product manager for Nova Healthcare. And joining me today is Todd Martin, our Chief Sales Officer. Todd's been with Nova for 10 years. And he has overseen great growth in our sales and marketing departments. So we've really expanded out to a lot of different functions beyond what a typical TPA does, including back office medical management for other TPAs and level funded plans and unique collaborations with others in healthcare to deliver the best services. And also very excited to welcome Dr. Adnaan Sheriff. He is a partner at Amherst Medical Associates. He is a 2014 graduate of the Philadelphia College of Osteopathic Medicine. And in 2017, he completed his residency in family medicine and osteopathic medicine at Sisters of Charity Hospital here in Buffalo, New York. And he is board certified by the American Osteopathic Board of Family Physicians. So thank you for joining us today, Dr. Sheriff. We've got a great conversation coming up. And a little bit about Nova. We've been around for almost 40 years now. And we focus heavily on trend management, reducing healthcare spend, and improving health plan performance using data, and taking a 360-degree view of our health plan members and our clients to ensure that we're delivering the best healthcare solutions, delivering quality and value. And Dr. Sheriff comes to us from Amherst Medical Associates, which is a family medical group practice with several physicians and sees over 9,000 patients. So the spectrum of health plan performance management opportunities is the framing that Nova uses as we think about how we provide healthcare benefits and services to our clients. And it really looks at the whole picture of how healthcare works. So if you think of the companies that come to us for their self-funded services, that's really that white light source, that single beam of light that comes in, the TPA partner, which acts as the prism. And that refracts the light and creates this whole rainbow of all these different creative solutions, all the different components that you need to deliver really solid benefits and good health to your members, to your associates. So when you look at the spectrum, this is our second webinar in this series. We've already previously discussed network. Coming up, we will also have wellness, medical management, pharmacy management, benefit design tiers, and reimbursement. If you're interested in seeing a replay of the network webinar, that will be found on our YouTube page. And today we're going to focus entirely on telehealth. So thank you for joining us for episode 2 of our Spectrum series, where we are going to talk about primary care in a virtual setting, the explosion of telehealth that we've seen over the last year. I'm going to turn it over to Todd to talk about the 3 points on the Telehealth Solutions Spectrum.
Yeah, thanks, Teresa. Appreciate the introduction. And Dr. Sheriff, thank you very much for joining us here today. When I think about telehealth, there's a part of it that really kind of makes me think technology, and as technology evolves, people really accept that technology into their lives at different paces, at different wavelengths. I think about the evolution of snail mail going to email, the phone call going to FaceTime. And now, that's transitioning into how patients are receiving care, whether it's because you're in a pandemic, whether it's because you have children at home and you can't make it to the doctor's office, or maybe it's just after hours and you don't really know where else to go. But that is a transition, and it's a big part of technology being welcomed into people's lives. From the other side of it, we're going to hear from Dr. Sheriff as well, there's actually a big bonus of that technology from a primary care perspective as well, because it really allows them to work more efficiently from their side of the house as well, spending more time with the individuals that have to come into the office, and then really doing things, that it can be a quick conversation, in a little bit more technologically advanced setting. When I first got into the business, 10, 15 years ago, telehealth was really unheard of. And, one of the trending things at that time was a 24-hour nurse line. And for an employer to offer the 24-hour nurse line to their members, it was great. People had somebody where they could call 24 hours a day and they could get some advice. But those registered nurses that would take those phone calls couldn't really direct care. So we really evolved into more of this telehealth setting where now many patients and providers are having those conversations in the form of e-visits, where if it's not something that needs to be done in person, they could be done through either maybe a phone call or some sort of FaceTime or Skype model. Many providers, have incorporated this into their day-to-day business, but it's also a way for them to also support members on a 24-hour level as well. Another area of telemedicine or telehealth is really some of the vendors that you've heard of, like a Teledoc, that provide services, outside of normal business hours. So if somebody might need to go to urgent care or the emergency room, it might be an alternative for them to go for having to pay those high costs from going to those locations. Also, they might be able to address simple symptoms like a strep throat or bronchitis, or maybe a pink eye where they could get a prescription where you couldn't get that, with a 24-hour nurse line. And as these really conversations evolve, there's really more of an effort into the virtual setting as well to help people manage chronic conditions, so how can we have devices or wearables that membership has that maybe integrates with a third-party health coach that helps them monitor something like diabetes. So the spectrum of choices when it comes to virtually seeking care has evolved, and really looking forward to hear a little bit more from Dr. Sheriff's perspective on how that's affected his practice. But we're going to do a quick poll question here. Which area of the telehealth solutions spectrum did you or your clients typically fit into prior to the pandemic? So if everybody wants to take a quick vote on that, it would be great to see some of the feedback. I feel like this is a big generational gap, because I used to be more, I was always open to virtual type settings with a provider, but I think about somebody my parents' age, somebody that was probably very closed-minded to that and said, I can't see my doctor, via Skype or FaceTime. But once they're forced into it and they get accustomed to having conversations with their grandkids through a pandemic, it opens their eyes and realizes that they can really, accomplish a lot through this means of communication. So with that,
thank you for participating in our poll. And thank you, Todd, for your perspective from the industry view. We're very excited today to present the physician's perspective, the side that we don't usually see, who's on the other end of those telehealth visits and what goes on in the infrastructure behind all of that to deliver medicine to people right in their homes. So if we look at how things were 2019, even very early into 2020, when we were before the pandemic really hit, there were a number of barriers to telehealth adoption to make it more widespread. It was challenging from a security perspective. Something like Skype, while it's great and has evolved in current time, back then really didn't have any security features on it. I think FaceTime still does not have some of the HIPAA standard security features, so doctors have to use other portals, other means of using or of accessing care. We're also creatures of habit. We're used to a physical looking and feeling a specific way. If you don't go to the doctor's office and put on that paper gown and go through all the different steps of having your ears checked and your tongue checked and your knee hit with a little hammer, maybe you didn't feel like you really got, your full physical for that year. It's an adjustment to realize that you can actually have good quality medicine delivered in a remote setting. And from the physician side, there was also not a payment structure that reimbursed doctors adequately for providing telehealth visits, and it was also taking time away from patients. So we're going to talk a little bit about how that's changed, that also kind of where we started from Dr. Sheriff's perspective. Just some quick statistics to throw out there before we get into the questions that we have for you. If you look back to the year before the pandemic, it was less than 1% of telehealth claims were for outpatient consultations. So 0.3%, that's so incredibly low. It was just not widely adopted. And then in the first quarter of 2020, even as the pandemic was developing, but before it had really taken hold, we were already seeing a 50% increase. People were starting to shift over to that. And then if you look even further in the next quarter of 2020, it went up to 46% of patients said that they used telehealth for some visits, which was more than a 400% increase in 2019. So it went from 11% to 46% just like that in a year. So, Dr. Sharif, how does that look for you in your medical practice? You know, as we look at the questions at the topic here, what was your practice's pre-pandemic experience?
Thank you, Teresa. So first off, thank you and Todd and the team at NOVA for having me here today. Certainly, we've gone through a lot of transition in this past year, and telehealth is definitely one of the biggest things that have changed within the past year for us. So pre-pandemic, our practice itself is a suburban practice. So we have about 9,000 patients, as you mentioned. Traditionally, majority of our visits pre-pandemic were what you would consider your traditional doctor's visits. Patients would call, would schedule an appointment, come in, have a physical exam at that time, talk in person, and then have a treatment plan. However, starting at the end of 2018, we realized that we would be shifting toward a value-based model of care, and we wanted to figure out, was this an opportunity for us to be innovative in the way we delivered care to our patients? So that was when we started to really try to ramp up our number of patients who felt comfortable using our patient portal so they could communicate with us in a digital platform. We started implementing e-visits at that time, which patients could initiate. And then towards the summer of 2019 is when I myself started to do video visits in our practice, just to really get comfortable with communicating with patients in different ways. And at that time was really only for mental health illness. And then fast forward to the pandemic, we really had to morph rapidly to be able to deliver care to our patients. So we were already kind of in the process of bridging that gap prior to the pandemic. When the pandemic hit, we really accelerated that process, and it's worked out well for us since then.
Great, so you were really an early adopter to telehealth, so you were a little bit ahead of the curve. But one thing I noticed that was interesting was that your practice had been moving toward a value-based model instead of the fee-for-service model. You know, one of the things that had been a barrier to adopting telehealth was there weren't really good billing codes for it. It was really not treated as the same as a regular visit. So do you believe that that is partially what has made telehealth more attractive, is that so many more physician practices has moved over to that value-based instead of fee-for-service model?
Yeah, I think specifically in a primary care setting, it's become more attractive because we're not as strapped as far as revenue is concerned as we may have been in a fee-for-service model. And I think in that sense, we as providers really just want to take care of our patients in the best way that is fit for them. So if that means that we do a phone call or a video visit, I would hope that our management is the same as if we saw the patient in the office. And so I think in primary care, the fact that we are majority now in a value-based model really has allowed us to be able to offer these services. Now, everything does have a cost associated with it as well. And prior to the pandemic, we were actually losing money by doing a telehealth service simply because it wasn't covered. But it ended up being a blessing for us in the sense that when that time came, we were able to switch gears very rapidly. So I would hope that as the models change for payment in other specialties too, that telehealth becomes more and more adopted, not just in a primary care setting.
I think that certainly makes sense. What do you see as the difference between a telehealth solution with your regular doctor, your primary care physician, compared to, say, going out to a leased telehealth network or a solution that's added on to your benefits plan from a private vendor?
Yeah, I think it's much easier to take care of your own patients in that setting, simply because you have access to their history. You know that so-and-so is a very anxious person, and maybe their demeanor may be a little different versus if someone else saw them from an outside perspective, they may take that the wrong way. So I think having a telehealth platform in a primary care office setting really allows for better quality care and also more accurate diagnoses and better treatment plans because you know your patients to begin with. As opposed to a third-party vendor where maybe only seeing them for a 5-minute span and really doesn't know the background to that presentation. So I think this has become an opportunity for us to really be able to deliver care to our patients in multiple different ways.
So that third-party vendor might be better as like an urgent care alternative, not really a care replacement.
Correct. Yeah, I would say after hours for sure in that setting.
So along that same line, what do you think are the opportunities to better integrate this virtual PCP experience and the telehealth experience if anyone is using any of those third-party vendors to help you really remain at the centerpiece of care?
So part of it is helping practices adopt telehealth as a platform. I think for us initially payment was a big issue, and that has since passed. I think now is about comfort level between providers. And I think employers offering that solution in part of their package to their members too. So I think from a primary care standpoint, initiation of technology, using that technology and allowing that to be adopted in really would help us deliver care better to our patients long term. And I'm sure Todd had mentioned wearables down the line. I think that's the next level of this. So integration of even further technology to members really allows for better overall experience of care.
We're going to touch on that a little bit more in a few slides. But of course, last year we were all pushed into this world of COVID-19, remote work and remote patient visits and all this sort of stuff. But it really led to a huge explosion of adoption of the technology and even innovation of new things. And I think we've now come to a realization that telehealth is a tool that can really meet people where they are. That's something that you definitely were experiencing even before the pandemic with the behavioral health visits that you were doing. That is a condition that unfortunately is very often stigmatized. That probably made it easier for people that were reluctant to be seen seeking out services to go in and actually have access to those services. It can actually make patients more involved in their health if they had any sort of reluctance to really engaging by going to the doctor's office. Maybe they had white coat syndrome and felt nervous sitting on the table across from a doctor. But there are all different internal barriers to care too, that this gives patients more of an opportunity even in their homes, as we talk more about the wearables in a minute. But you can also treat issues in real time, and like we said, the focus on behavioral health. So all that falls under this idea of a digital health management strategy, which we would have as your health benefits organization, but which we understand Dr. Sheriff also has as a provider. So if you look at how things have changed after going through kind of the COVID blender of telehealth, we've seen a 24% increase of telehealth claims for privately insured outpatient consultations. There was a huge decrease in primary care office visits during that second quarter of 2020, but we saw that there was a significant increase of office visits. And in fact, it was a 35% increase in telehealth visits. So the number of visits that decreased because of people not going into the doctor's office were replaced and then some by people actually engaging telehealth visits. One of the areas that continues to be a barrier that is going to have to be addressed in the future is really looking at some of the issues with people accessing telehealth services. Maybe it's like Todd said, people his parents' age, my parents' age, that are reluctant to engage in new platforms of technology, but also areas where there's good broadband access, where there may be language barriers, say someone where English is not their primary language, maybe a general discomfort or even mistrust within the healthcare system and underserved communities. So there are different access points that we don't have built into the system yet, but that we anticipate will be available in the future. So Dr. Sheriff, we could talk through some of what you've done to embrace this digital health management strategy and really look forward into the future. What does it mean to you to even have a digital health management strategy?
So for us really is utilizing different means of technology as efficiently as possible to really help deliver our care to our patients. At the end of the day, our aim is to really focus on our patients' quality of life, making sure their chronic disease states are managed well. And for us really is integrating things like telehealth, integrating things like remote monitoring to really try and make sure that we understand the whole picture of our patients in order to improve their outcomes ultimately. At the present time, it's really about integrating different forms of communication back and forth. So either be it through synchronous video, audio services as well, utilizing things like the patient portal as best as possible. At the present time, I think in the future we'll be going more into the remote monitoring realm.
We've been hearing a lot about those too. Go ahead, Todd.
Yeah, no, Dr. Sheriff, so you mentioned kind of like seeing that holistic view of your patients. Do you ever, and how frequently, get any sort of indication of somebody that might have gone outside of your walls of an organization to seek care in terms of like a telemedicine third-party vendor like Teresa mentioned before? Is there any sort of connection between those two ever?
So we've been told that there's supposed to be, but in reality, it doesn't happen as much. I would say this whole time, I've learned of patients maybe seeking a third-party vendor service because I've communicated with them after the fact, or their condition is not improved. But I never necessarily receive a note that so-and-so went to a third-party vendor until I find out afterwards. So I wish there was more seamless communication because for us, transition of care and continuous management is really important. But at the present time, no, that doesn't occur.
Okay, thanks.
Yeah.
So when we talk about the virtual care timeline of say a patient comes to you for a telehealth visit and they're having a particular episode of care, let's say it's not for their annual physical, it's for a particular problem that's come up. What is that virtual care timeline like from when they first reach out to your office to when their issue is resolved?
So it initially starts depending on how the visit is initiated. So the way our practice is set up at the moment, we do have built-in e-visits where a patient would log into their patient portal and they can select what condition they're having, be it a urinary tract infection symptom, sinus infection type symptom, and then it'll drop down a menu of questions that we would normally ask at their visit. That would then come directly to the provider, and then we would respond back in a short time period. So that timeline is really patient initiated. What most of us kind of think of as telehealth these days is more of a video or a phone-based visit. In that situation, the patient will call, that appointment would be scheduled, and then at that set time, we would connect. So I would say, Teresa has a visit at 10:20 in the morning. I would make sure I either log on to our video platform or give you a phone call at that time. We would do the visit through that means, and then I would type my note like I traditionally do for any in-office visit as well. And that would be pretty much the end of the visit. So the only difference really is how that visit is initiated, plus what platform that visit would take place in. But it would happen in pretty much the same structure as a traditional in-office visit.
And if you were to send, say, if I was the patient, you were to send me out for lab work and get the results in, a lot of times, the doctor wants you to come back in for a follow-up visit, sit down and go over the labs. But in an e-visit, that would not be necessarily the case, correct?
Correct.
Okay, so how are you able to connect with patients who may not have access to the internet or who may be reluctant to use it for medical services?
So with that, again, going back to the different means of how we communicate with our patients, phone call has always been a way to communicate with our patients, and I have a phone sitting right next to me at the moment, and that's something that most patients will have access to either through a cell phone. I know landlines are kind of falling away now, but we still are able to provide care in that way. So as far as your question before about results, I can always call a patient to go over those results. We're able to send letters like we've done for hundreds of years as well too. So, there's always a way to communicate with our patient. It's just a matter of choosing what platform is best for them.
Right. So you're meeting the patient where they are and where their comfort level is, using all the means available to you, which makes sense.
Exactly.
So what do you think this looks like as we move beyond the pandemic? Telehealth is clearly not going away. If anything, it's only going to grow bigger and probably better. So if you had your crystal ball, how do you think it looks in the future?
I really, like you said, telehealth's here to stay. I actually read an article this morning, 83% of patients who have used telehealth during the pandemic do intend on using it again in the future. So they've had a good experience with it. And so I think part of the physician standpoint is how do we integrate that into our workflow? For the longest time, we've had visits scheduled ahead of time. We come into the office, we know exactly what we're going to see that day and see the patients in person. I think in the future, it's going to be a mixed bag where we'll have a mixture of phone visits, mixture of video visits, mixture of seeing people in the office as well, plus, throwing in some visits that we may not anticipate ahead of time in there as well. But I think as a physician, we've had to become very comfortable with different platforms of communicating with our patients, just so we can meet the patient where they are, as you said, but also deliver the best care possible.
And are you finding this is actually able to give you a little bit more quality time with your patients that may have a little bit more intense need than just, a quick question? Now that you don't have to book all the office visits to see them, you can actually deal with that more quickly and then spend more time with other patients.
Yeah, that's absolutely a good point. So when I first started practicing, my visits were traditionally 15-minute and 30-minute appointments. And then as we got more patients onto our patient portal, they were communicating with us in different ways. We were triaging patients who needed to be seen in the office versus not. And now with telehealth, the number of patients I see physically during the day or scheduled appointments is actually less than where it was before. But I am spending more time coordinating care either through the patient portal or responding back to e-visits. So the patients that I do see are either for their annual wellness visit or patients that really need a complex sort of evaluation and assessment. So I would say my patients that I see are sicker, but overall everyone is able to receive care in different ways.
Mm-hmm. And so that ties into what we've talked about wearables and digital patient monitoring, continuous monitoring, health coaching. All of these things relate to chronic condition management that we're now able to do, behavioral health, nutrition, sensors, wearables, therapeutics, devices. I mean, like I've been using e-visits to see a nutritionist over the last year. And it's great because I can just walk into the kitchen with my portal on my laptop and show her what's in my kitchen. And these are things that we've unheard of before any of this. So when you look at really dealing with chronic conditions and all of these different opportunities, you're also generating a lot more data as you're monitoring whether it's a patient's blood pressure or their blood sugar or their weight or any of the things that you need to monitor. So what impact does that have on how you deliver health to your patients that do have chronic conditions or need a little bit more coaching?
The data can really give us good insight into the hidden things that we may have missed previously. So for example, pre-pandemic, a patient may have come to me and said, yeah, I walk 30 minutes a day. And then you maybe through a wearable device, now you see that they're only really walking maybe 1,000 steps or 2,000 steps. And that's an opportunity for improvement for them. So I think data can be beneficial in a sense. From the physician standpoint now, it's all about trying to evolve with this process and understanding where data can be best used. We get inundated with so many different sort of numbers and statistics all day long. It's a matter of what is truly applicable and what is going to be most impactful for our patients. But I think we're at that phase now where we're trying to filter that and realize what is most appropriate for our patients versus what's not.
And are you finding they're coming to you with more questions as they're maybe doing a little bit more self-monitoring? We've moved from beyond Dr. Google to now it's wearable Google.
That is so true. I tell my patients, Dr. Google is great. There's a lot of information that he or she or they may have, but they didn't go to medical school, so they don't filter that for you. Right. That's really where I'm very thankful that my patients have a lot of questions. They feel very comfortable coming to me. They may have done a lot of research ahead of time, and it makes for a really fruitful discussion with them. So I can definitely see that trend growing and growing in the future.
Mm-hmm. I mean, it sounds like you already have a great level of engagement and rapport with your patients. Just from talking to you as we've been preparing for this, I can see that you have a wonderful manner about you that I think probably makes it easier for your patients to sit down and talk with you, which has to make it easier. But if you don't have that pre-existing relationship with a doctor, I can see where also that much data could be overwhelming if you don't have someone to kind of help you through navigating the pathway. A lot of the tools we're seeing do have coaching built in to help people that maybe don't have such a great relationship with their doctor or have a lot of reluctance. So that's something that we're definitely seeing develop further into the future when we look at the current state of healthcare engagement. I think that's really what telehealth is turning into. It's not just one mode of delivering care, it's becoming part of a bigger healthcare engagement ecosystem. So as the TPA, that's something we want to be really mindful of as we're looking at what product we want to deliver. Clearly on the physician side, that's something that you're thinking of frequently of how you can continue to deliver high quality care to your patients. And as we look to the future, I guess we can't say entirely what it's going to look like. Maybe we'll have hoverboards delivering medications to us, maybe we won't. But we've had a lot of reluctance. We've talked about generational issues of our parents maybe not being ready necessarily to take on so much telehealth. But I guess if you guys aren't ready for that, your kids are going to love it. Can't wait to see what our kids end up with in the future for telehealth. Maybe they'll be doing everything remotely. So that wraps up all the content for our presentation. We are going to switch over to some question and answers. But before we get to that, one point that we do want to bring home that ties together the whole spectrum is that a lot of these dialogue that we're having, whether it's with Dr. Sherif or with the different vendors that provide different telehealth solutions, the conversations Todd has with prospective groups all the time, our role as the TPA is really to understand a group's tolerance for change, understand what the employer's goals are with relation to their associates, to engage in these conversations around these specific topics. Make sure that you understand where you are in the spectrum of care, where you want to be, what your goals are. And our goal as a TPA is to improve your plan performance and health outcomes over the long term. So with that in mind, the next installment of our Spectrum series is going to look at wellness solutions, and we're going to be announcing those speakers sometime probably in the next week or so. So keep an eye on your inbox or follow Nova on LinkedIn. You'll learn more details about who's going to be joining us for that webinar, which will be June 9th at 2 p.m. I'm going to go to our questions here. We've had some questions coming in. So let me see here. First question is a Nova question. So Todd, I'm going to throw this one over to you.
Okay,
how will Nova continue to support telehealth for clients post-pandemic?
How will we support telehealth solutions for clients post-pandemic? Did I hear that right?
Yep.
Yeah, so it's been amazing to see the transition, not just here locally with your family and friends, but also a lot of our clients to implement a third-party vendor that cost money. 3-4 years ago, that was considered a big step. But I think since the pandemic, the majority of our clients are now covering e-visits, where they can obviously seek care from their primary care physician as they would normally in an in-person setting. So I know we've done a lot of amendments for that. I think that the third-party vendor, it's a good fit for a lot of our clients as well. So I mean, back to what you just kind of touched on when you wrapped up. It's really understanding each population in itself, understanding, what the demographic looks like, what type of region is it, right? So, I mean, is it a very, very rural region where the people might not have access to care in their backyard? So, I mean, is it something like as simple as a third-party vendor, or do we maybe look at a more robust virtual primary care type solution? So everything that we do, Teresa, as there's nothing about healthcare that's a one-size-fits-all approach, especially when you're an employer trying to put together a benefit solution for your employees. But it's really just kind of understanding their needs, their demographics, their region of where they live, and the type of access that they have care to in their backyard is really how the best way to, craft the program. Because at the end of the day, these are the claims that we want to see. There's always good claims and there's bad claims. The bad claims are the people that are avoiding the conversations with their primary care doctor, and they're the ones that are ending up in an inpatient setting because they're either not managing a condition or else they don't even know about it. So the more good claims in a primary care setting we can drive, the better. And the way that we deliver it really is not a one-size-fits-all approach. It's really understanding how we know that these members are open to accessing it. If we have average age 30-year-old single guys, that's the biggest hurdle. None of those people want to create a primary care relationship. So what type of tool can we bring in to target them? But I could go on for hours about this, but yeah, I hope that kind of answers your question.
Okay, so this question is for both of you. So I'm going to start with Dr. Sheriff. How long does it typically take to implement a telehealth solution?
So the first step to, implementing a solution is figuring out what technology and platform you're going to use. For us, luckily, our EMR already had that feature built in. We had been piloting and using it before the pandemic. So when that time came, it was easy to switch, to all of our providers in the office as well. So that's step number one as far as implementing that solution. The harder part for us was how do we market to our patients and letting them know that we have this platform for them to use. And that's been a slow, gradual buildup over time. And thankfully, I think the openness to adopting that and using that came from the pandemic as well. So it's I would say the timeline is not long to using that. I think a lot of EMRs now will have EMR, electronic medical record system, will have the means to utilize a telehealth feature. It's just about training your staff and actually getting that workflow down pat.
And on the TPA operations side, I mean, from the product perspective, it's really get the contracting in order and get the files going back and forth. Todd, I don't know what further happens on the sales and marketing side.
No, I mean, I just kind of want to go back to Dr. Shree's response real quick, and I know that like we've mentioned, and I don't want to put you in a corner and get you in trouble by any stretch of the imagination here with your answer. But, when we talk about, our parents' generation, really being slower to adapt to types of, e-visits or any sort of virtual type care, do you find that there is a roadblock with maybe that generation that's really more focused on retirement from the provider side of the house and not really wanting to adapt, and because they don't necessarily believe in it, similar to that same demographic would feel to receiving care in that manner?
Yeah, I think there's some hesitancy to adopting it, and I think as we age as a population, we get fixed in our ways. So, for someone, it may be, like Teresa had mentioned very early on, the visit is not complete if the doctor has not, listened to your heart or, examined you in person. But interestingly enough, I think those patients, when, time strikes and they really need care, they will adopt that and they will embrace it. We have found that most of our patients who utilize telehealth platforms actually tend to be middle-aged or older. The younger patients are just hard to get a hold of, in general, very picky about how, they want a specific thing communicated to them. So it was kind of the opposite of what we expected. We expected our younger patients would be more likely to use telehealth platforms, whereas we find that our older patients are much more engaged in those platforms.
So it's the millennials and not the baby boomers we have the problem with.
Exactly. Exactly.
Lucky for us though, Gen X, still good. Right down the middle. So we talked a little bit about security. HIPAA is obviously always a concern in any medical situation. So how do you believe telehealth balances both usability and security?
So as far as security is concerned, as I mentioned, our EMR is kind of where we integrated in our telehealth platform. So that part was already checked off for us. I think it's very important as, the pandemic is still continuing on, but as it starts to wind down, I think a lot of the restrictions regarding secure platforms will likely be put back in place. I know they've been lifted for a bit of time. So that's something definitely I think as a vendor you want to consider is are you able to communicate in a means that is secure, not only for you as a provider, but also for your patients too. And then usability is extremely important. It has to be seamless to use. Physicians are very much in the boat that you get one shot to prove it to us. If it doesn't work the first time, we're not going to use it because we have too many other things to worry about. We can always fall back on our old ways. So I think that becomes very important to pick a vendor or a platform that's been tried and tested, as opposed to just kind of throwing something as a feature out there. So for us, I was initially the pilot person for a lot of the things that we did from a telehealth standpoint in our practice. So made sure that all the kinks were worked out, and I could teach some of the old guns in the practice how to use them too. But on the flip side, it has to be equally friendly to use from a patient standpoint too, which most things are typically.
That's something we look for when we are sourcing vendors as well. That's very important to us, is what's the overall user experience. So when we do our vetting, that's something we pay attention to very closely. I agree with you. If it doesn't work well the first time, why would we want to push it out there for our clients or for our members to use if we find it questionable? So we're equally rigorous, I think, on the TPA side. We have one more question. I'm going to start with Todd to answer this one. As the definition of telehealth continues to expand, what competitive pressures do companies face to bring on all the newest tools, even though they might not all be useful or relevant?
Yeah, I think that's important when selecting those tools, because there, as well as Teresa, right? So you kind of oversee a lot of vendor relationships at our organization, and you probably get about 30 emails a day, right? And a lot of them really focus on maybe managing one specific condition. And the problem is, a lot of the vendors say, you need to have this for every single one of our clients, but I think that's where partnering with a good TPA, or just really knowing your claims experience and understanding your population's claims experience, to be able to dig down into that data and understand, what are the driving conditions within my population, and what are the available vendors out there to help manage those conditions. We have a lot of vendors that focus on, diabetes, But why would you implement some sort of diabetes monitoring program, whether it be through a wearable or some sort of e-health coaching, if you don't have any diabetics in your population? So I think it's really important just to know the claims experience, know the conditions or the cost drivers within the population, and then understand, what vendors are out there and what might make sense to bring in to help manage. I think that answered it a little bit, right?
Yeah, I think that covers it. I definitely agree. You are correct. We get a lot of outreach from some very specific vendors that sometimes it's something that just doesn't impact our population. So it's great to know that it's out there in case we find that the data trends that way eventually. But if it's not relevant to us in the, at that point in time, why we're not going to sell it to the group.
Yeah, and the one thing I know that we've always really focused heavily on at Nova is if we're going to bring in a vendor, we want to understand the utilization, right? So we want to know who the membership is that you're working with. We want to understand their specific data, because at the end of the day, unfortunately, Dr. Sheriff doesn't always know, as he mentioned, what is going on outside of the walls of his organization. And what's going on outside the walls of the organization, they might not know what's going on within the walls of Dr. Sheriff's office. So a lot of times, us as the TPA or the health plan, we're the only ones that are pulling data from all the sources, whether it be at Dr. Sheriff's office or pharmacy, maybe someone's doctor shopping, but being able to pull in the data from those vendors as well, we can kind of get the holistic picture within our clinical platform at Nova, and then we have the ability to share all of that data back to the patient's primary care physician, which really helps us kind of build out relationships with, our members' primary care physicians' offices as well.
Well, and also with our employer groups to give them a dashboard snapshot of, what the engagement level is for their patients, is something really working for them. That's all part of it too, that really careful, personalized management of care. But Dr. Sheriff, I'd be interested in your take on that question. As telehealth expands, what do you think are the competitive pressures for physician offices in adopting?
Yeah, so I think patients now have stepped or put their toe in the water a little bit as far as telehealth is concerned, whereas they may not have a year ago. And so we haven't felt that pressure yet necessarily to patients asking us ahead of time, do you offer telehealth or not? But I can really see that being something that's asked down the line. Nowadays, patients are asking for different ways to communicate, not only with their health providers, but even different services online. If you go to Google and you want to search up, say a plumber, for example, and you may not feel comfortable calling someone on the phone, but if they have a chat service, very easy to communicate with them that way. That's very similar to communicating through your portal or an e-visit with your patient there too, or your doctor. So I do think that as this expands, it may become prudent for a lot of physicians to actually offer this as a service. Now, again, it has to be appropriate for sure. I think primary care, it's nice. We want our patients to engage with us regularly, whereas another specialty may not be appropriate to use a telehealth service at all. So it will change from different specialty to specialty. But primary care, I do think that it behooves a lot of practices to offer this as a service. And as I think it's here to stay for the long haul, for sure.
And I know I think I kind of went on a little bit of a rant, maybe didn't address the specific question, but like when it comes to like the pressures of our clients in general, I would foresee that all of our clients moving forward would be covering e-visits. Any way that we can obviously help increase engagement with a primary care physician is a win for us, and it's a win for our health plan. Opportunities to get answers to questions and have things diagnosed and get scripts outside of an urgent care, an emergency room, is a win-win, anytime for anyone. So that's, I think, more of a specific answer to the business side of the house.
And I think that's actually a good note to close on. So it really is that collaboration between the physician community, the vendors that we see, many of which are physician-based as well as technology-based, and with the health plans, the employer groups, the members, we're all part of the system together. We all play our different roles, and as we're seeing telehealth evolve and expand, we're all going to play a significant role in the future. So Thank you everyone for joining us today for our Spectrum of Solutions webinar on telehealth, and we look forward to seeing you in June for our discussion on wellness. Thanks. Enjoy the rest of your day.
Thanks, everybody. Thanks, Dr. Sharif. Thanks, Teresa.
Absolutely. Thank you for having me.
Yep, our pleasure.